Good afternoon. I would obviously like to direct my comments to the media that are here or maybe watching across the state, but I also would like to direct my comments to the citizens of Beaver County, Washington County, and to be honest, all 67 counties of Pennsylvania. This weekend, a political campaign was launched by UPMC throughout the Commonwealth. This campaign included robocalls throughout the state, as well as a politically charged mailer spanning at least 3 legislative districts. The management of UPMC is clearly willing to stoop to a new level to protect their business model, a business model that is intent on having a monopoly of the Western Pennsylvania healthcare industry. Clearly, they will go into the political mud in order to attack anyone who disagrees with their attempt to deny patient access because they have the wrong insurance card. Let's look at their claims and how inaccurate they really are. The mailer that you see claims that Representative Frankel and I are trying to, quote, reduce health care insurance competition and take away choice for consumers. Ladies and gentlemen, that claim can't be any further from the truth. The Patient Access and Consumer Choice Act, House Bill 1621, 1622, ensures that choice and competition will be in place for years to come. It ensures that national insurers won't be locked out from the marketplace like they had been for a decade. It ensures that the marketplace, our constituents, will dictate what hospital they go to and what doctor they will see. The mailer also tries to make the ridiculous comparison that this bill is similar to the health care reform efforts in Washington. Let me be very clear. Washington could learn a lesson from Harrisburg. Washington could learn a lesson about bipartisanship. Washington can learn a lesson about ensuring patient access and choice in the marketplace. One dominant provider that has a monopoly isn't much better than letting the federal government run the healthcare industry in my book. Choices and competition, a real marketplace, will drive better results. Now let's look at the very important letters on the return address label, the letters UPMC. Ladies and gentlemen, these are the same 4 letters that are proudly displayed on the U.S. Steel Tower in Pittsburgh. Those are the letters of a purely public charity that receives hundreds of millions of dollars in tax breaks every single year. A purely public charity that sends lobbyists to Harrisburg every year to beg for taxpayer dollars to build and update their facilities. A purely public charity that has been spending millions of dollars that belong to taxpayers, belongs to the patients, belongs to the employees of UPMC. They haven't been spending those dollars on patient care. They haven't been spending it on compensation for their awesome doctors and nurses. No, they've been spending those multi-million dollars on ad campaigns. Now they're spending tens of thousands of dollars on campaign mailers and phone calls to protect their monopoly and their business plan. I would rather see those dollars given to the amazing doctors and nurses of UPMC that have given their careers for that institution. I would rather see those dollars spent on Christmas or Hanukkah bonuses for them rather than political mailers. So whether members of the House support, oppose, or are undecided about our bill, I hope that our colleagues, I hope that the Attorney General, I hope our governor will stand against these tactics. We should never see dollars from tax breaks going towards this type of material. I've been thankful for Representative Frankel's support and leadership on this issue, and I'm very thankful that he's here today to join me in denouncing these type of ads. Representative Frankel?
Thank you, Jim. As many of you know, Jim and I have pretty different worldviews here in Harrisburg on many issues. But with respect to health care and where our Commonwealth is going and where the state of health care is in Western Pennsylvania, we have a common view. And I'm here to say that I'm proud to stand here with my colleague in light of these baseless and misleading attacks on his character and motives. I find it extremely disappointing that UPMC, an organization that carries the title of not-for-profit, purely public charity, would resort to this kind of attack, which is clearly meant to take the focus off of genuine health care access in Pennsylvania. I also find it incredibly cynical that an organization that supports the Affordable Care Act and has talked about it in many different forms would turn around and use it in a negative comparison of what my colleague and I are trying to accomplish. UPMC is quick to accuse others of playing politics, but their actions over the weekend make it clear that they are the ones playing politics. It is clear to me that this is just another attempt to take the spotlight away from the bipartisan, common sense legislation that has been put forth by Representative Christiana and I. Our motives are patience, not politics. We want to strengthen health care access for patients, and more importantly, we want to see better health care outcomes. We want to foster genuine competition amongst not only insurance companies, but also among health care providers. That is an absolutely crucial aspect of our legislation. We want health care competition between insurers, but equally, if not more important in the current environment, we need health care competition between providers to bend the curve on cost of containing the cost of health care. Bending that cost curve is one of the defining issues of our time. It is unsustainable, and that is what our legislation seeks to start to address. We can achieve these goals by working together, but senseless attack ads like this are meant only to distract and to confuse. I call on UPMC to stop with these baseless, personal, and expensive attacks and focus on the real issues of providing quality, cost-effective health care to the residents of Western Pennsylvania. Thank you.
Turn it over for any questions.
Is this the first time that UPMC has targeted against one of you personally in fighting this?
It's the first political mailer into a district that I'm aware of. I've heard of some robocalls, but I believe from my colleagues that I've talked to throughout the state, these robocalls were specific to invite the residents receiving the calls to call their legislator and tell them to oppose Representative Christiana's bill. So this is the first time, I believe, that I've seen the attacks bear someone's name.
This is, I think, unusual compared to what we have had an effort, certainly in my district, which incorporates many of the UPMC facilities and many thousands of UPMC employees. There has been an outreach by UPMC to those employees to ask them to enlist in a campaign to ask me in particular to back off of this legislation. They have sent out emails and letters to those employees asking them to engage. We've had a very limited response considering that I think I have between 7,000 and 8,000 UPMC employees in my district. Most generally seem to be supportive of our efforts and know that while they may not know the intricacies of our legislation, know that the status quo in Western Pennsylvania has to be addressed and has to be changed, and I think are generally supportive of those of us who have taken a stand to say we want to see real health care reform with respect to how health care is delivered in Western Pennsylvania.
And I can't help but take my opinion in this is that these mailers and these robocalls aren't going to get me to stand down. In fact, it's I think given Representative Frankel and I even more motivation to see that these bills become law. But what I think the real attempt here is not to get me to stand down. We're clearly very supportive of this legislation. But I see this as an attempt to send a message to the other 201 legislators that if you support this bill, these type of actions will be used against you. And I think that was the real underlying message here, and that's my opinion.
Just to clarify, what you're saying with these robocalls, these went out statewide and were not specifically about you, but were generic only to the extent of saying, call your legislator to oppose your bill?
Yes, they were. I've heard.
You didn't use your name up front, or?
I didn't receive one of these phone calls. Some of my colleagues received them personally, everywhere from Harrisburg to Beaver County have received these phone calls. I'm not sure if they used my name in particular or just House Bill 1621, House Bill 1622.
Yes.
The Health Committee has scheduled hearings on these bills for next week. Is UPMC going to be testifying at the hearing? What do you hope to accomplish with the hearing?
Well, I do think that the timing is interesting for these campaign tactics and these mailers and robocalls with the hearing set for next week. Obviously, we want all interested parties to testify. I'm aware that the integrated delivery networks that this bill would affect in Western Pennsylvania, the Highmark Integrated Delivery Network, the UPMC Integrated Delivery Network will be testifying, as well as many other interest groups. What we're hoping to achieve from this is to have an honest discussion about whether or not market consolidation is going to continue. Representative Frankel and I clearly agree that these dominant providers are buying up community hospitals, it seems, every week, buying up doctors' offices every week. And my focus will be if these dominant providers go unchecked, they're able to be in the insurance business and the provider business, and they're able to restrict access. Long term, are we going to have a system where people can't get the care that they want and need? And that's a pretty scary thought. So I hope we have an honest debate next week, and the process will move along.
Just say, I'm trying to think back at an instance where a purely public charity that enjoys the tax-exempt environment that Jim described, and seeks charitable contributions from individuals, seeks government grants, receives support through tax dollars, through our insurance premiums, has ever launched this kind of a personal attack against an individual lawmaker. I can't recall something like that, certainly not in Western Pennsylvania, and I think it really calls into question a status of being a purely public charity. I mean, where is the standing, the moral standing of a charity to go after individual politicians in this state or in this country? I may be wrong, but I think it's unprecedented, and I think it's something that ought to be reviewed, certainly by us as lawmakers, and certainly I think even by the Attorney General.
And if I could add to that point, I think in my remarks, I made a pitch to my colleagues, the Attorney General and the Governor, to stand against these type of actions, because I do think we're in unprecedented territory. And going unchecked, if every lawmaker has to worry that a particular piece of legislation is going to be opposed by a nonprofit or a purely public charity that has the access to hundreds of millions of dollars, are they going to wage this type of campaign in the future? I think this is a litmus test that cannot go unchecked, and we need to be steadfast in saying that we do not, whether or not you support the legislation, this type of approach is irresponsible, and that the government is not going to stand by and allow those tax dollars essentially to go to campaign purposes, which this is clearly. And I don't think that can go unchecked. And I don't think we could understate the importance of having those leaders weigh in on these type of actions.
Dan, do you have any copies of any emails or letters that were sent to constituents?
Yeah, I have. We have plenty. I mean,
I don't know what they were about.
Well, as I said, I mean, I think they fall, I think, more in line with what might be acceptable. I mean, I don't find them as being personal as this. I mean, this, when you take a look at this ad here, it reminds you of the worst that you see in our campaigns, you know, and people are very critical of what we do. But when, again, a nonprofit, purely public charity engages in this activity, it's got to raise some questions. I mean, look, an organization that wants to ask its employees to engage in what they are saying is their best interests, I think may be fair game. I don't mind having that conversation with my constituents, but when it's personalized in this way, when it is clearly being used as a way to not only intimidate Jim and I, but also to intimidate other lawmakers, because this was being sent into other districts, not just into Jim's district. So it was like, you know, shooting something over the bow in order to be a warning to other legislators, certainly in Western Pennsylvania, that if you dared to be supportive of this legislation, this was what you might be able to expect. And I think that that's just not activity, certainly, that a nonprofit, purely public charity ought to be engaged in.
Backfire or help your cause?
Well, I mean, we'll see what you know, the public thinks. I mean, as I say, the times that UPMC has reached out to their own employees in my district, I get very little negative feedback. It's often, you know, the type of feedback that asks their employees to push a button and send a canned email. We've gotten a couple hundred of those maybe, but there are many UPMC employees who take the time and call us or write me a letter or an email and say, I got this email from UPMC, and I want you to know we believe you're doing the right thing. You ought to continue doing this. We think that while we're proud to work for UPMC, we're proud healthcare providers, we don't think that UPMC should be engaged in the types of activities that this legislation is trying to address. So I've been encouraged by the conversations that I'm having within my district with my constituents generally, and specifically with my UPMC employees as well.
And Brad, I'd like to add, it's important to look at who this mailer came from and who it was targeting. This mailer didn't come from a political action committee. This mailer didn't come from an employee group of UPMC. This is a corporate-sponsored mailer that was targeted to clearly a certain group of individuals. I think UPMC should answer to the question of where this mailer went. Did it go to Democrats? Did it go to Republicans? Did they use a system in place for political mailers like a 4 of 4 super Republican voters? Did this go to independent voters? That's important because I think that would show the clear motive here, which was not to get their employees to reach out to us, not to get their patients to reach out to us, but clear to affect voters to send the message that there are political ramifications for going against an organization like that. And so I think who sponsored this mailer is really important, and also who it was meant to charge up.
Anticipating what you might say here and that you're going to show this mailer, I asked UPMC for a response. Mr. Wood there says, Representative Christiana has stood shoulder to shoulder with a liberal union, the SEIU, to promote this bill. He has clearly abandoned so-called conservative credentials to promote a broad, intrusive government health care intervention bill designed solely to protect one dominant insurance monopoly.
Well, the good thing is that he didn't deny that the mailer was sponsored by UPMC. Clearly, he is defending his position and why this mailer is accurate to be against my free market record, which I'll take against many members of the General Assembly. What they refuse to acknowledge is that they receive hundreds of millions of dollars of tax breaks every year. What they refuse to acknowledge is that they pay high-priced lobbyists to come to Harrisburg every single year and to beg for taxpayer dollars to upgrade their facilities and to build their facilities. What he refuses to understand is that they're not a free corporation. They are not a private corporation. They are not traded on the NASDAQ or the stock market. They are a purely public charity that is in the healthcare business. And I think his comments just echo our disagreement on why government needs to protect patient access and avoiding monopolies in the healthcare industry.
You know, it's another comment that I find really ironic, because UPMC has, and this, you know, Jim and I have different opinions about the Affordable Care Act. I am a vigorous supporter of it. Jim is not. But UPMC has been a full-throated supporter of the Affordable Care Act and Medicaid expansion, and now they're trying to exploit the opposition to it, stir it up, so to speak, in order to attack this piece of legislation. You would think that they are against the Affordable Care Act by these comments, and they have not been. I mean, I've been at press conferences with UPMC members who have been supportive of it, and I think that you'll generally find that. So, you know, it's almost like they're willing to say almost anything at the end of the day in order to find a way to circumvent our efforts and to perpetuate a business model that is manipulating the reimbursement system in Western Pennsylvania and increasing the cost of health care. And they're doing this by trying to limit access to their doctors and their hospitals. And that's what we're trying to do. We're trying to make sure that we have real competition. And I got to emphasize, we want competition between insurance companies. But we want competition between providers. That is what UPMC is trying to prevent. They do not want to be going head-to-head with other providers, because that will expose, I think, the high cost of their system that is responsible for really making healthcare in Western Pennsylvania one of the most expensive places in the United States to get healthcare.
Brad, I would also like to add that while he can say that about my record and how it's contradictory to my record as a free market Republican, let's not forget that it wasn't that long ago that the Republican-led House, in an extremely bipartisan way, passed a measure that essentially would have put an end to this impasse between UPMC and Highmark. We were thankful that the governor got involved and reached a non-legislative solution. I think it's unfortunate the government has to get involved to solve this problem. But the fact is, the UPMC board has made it clear that they have no interest in settling this issue. The leadership team of UPMC has made it very clear that they have no vision of resolving this issue. I believe that Highmark would be the first one at the table if UPMC wanted to find a non-legislative solution in working this out. I'm still hopeful that they get to that point. The problem is I don't think that Harrisburg can wait around for that. And clearly it doesn't look like there is going to be a non-legislative solution in the near future. Even more reason we need to move decisively, and I'm thankful that the chairman's having a hearing next week. I see no other questions. I thank you for attending.